Okay, good afternoon, everybody. So, being that we're just a few days before Yom Kippur, I thought it would be a good time to talk about Cholim and pregnant women and nursing women fasting on Yom Kippurim and what happens when a person has to eat on Yom Kippur. So, first of all, it's important to know that we have a Mishnah that tells us that in general, whenever one has to violate an Avera, you always go with the lesser Avera rather than the greater Avera. So, even though we paskin that Chatzi Shir is also min Torah, that even eating Pachas Mikshir is an Isser Da'araisa, but it is a more kal Isser Da'araisa than eating a Shir Shalem, than eating a full Shir. And therefore, when a person is a Chola Rahman al-San, Sheyesh Bo Sakana, someone who's dangerously ill, it has to be Yesh Bo Sakana, then we would be Ma'achil Pachas Mikshir, if that's possible, if that's enough to be able to take the person out of danger. But again, it has to be a situation where it's Chola Sheyesh Bo Sakana. A lot of times people are under the mistaken impression that, oh, you have this out on Yom Kippur, that you could just do Pachas Mikashir, and therefore, as long as you as long as you're not feeling up to par, so you could just get away with that. A lot of doctors who are very frum and very sincere and very religious are under that mistaken impression. So it's important that we be clear about that is not true. That a person has to be, unfortunately, a person sometimes has to be a little bit ill in order to be able to fast in Yom Kippur. A person just doesn't have to put themselves in any sakana, even a somewhat far-fetched possibility of sakana. It's yadua that Reb Chaim Soloveitchik had a shita that we don't do Pachas Mikashir, that we do is Shir Shalem. There's a question of what he do with that Mishnah. So the assumption is, I think most of the poskim assume, is that Reb Chaim held that when a person is eating in order to avoid becoming a Chol Sheyesh Bo Sakana, so that's when you do Pachas Mikashir. But when a person is already a Chol Sheyesh Bo Sakana, then you do Kol Tzarcha, and Kol Tzarcha includes having a Shir Shalim. But our practice is that if it's doable, then we do Pachas Mikashir. Another thing to be aware of is that if the option is stay at home and stay in bed, or go to shul and have to eat, we much prefer stay at home and stay in bed. Rav Neuberger pointed out that Rav Shlomo Zalman Auerbach said that if a person by going to is going to have to eat anyway, and by going to shul will have to eat one more time over the course of Yom Kippur, one more Pachas Mikashir, better to stay home the whole day to avoid that one more time of Pachas Mikshir. Achila is a very, very big deal on Yom Kippur. There are certain things that people need to know before they ask their doctor. They have to know that they're speaking the same language as their doctor. A lot of times someone will say to the doctor, is it dangerous? And the way the Rav Shachter pointed out, the way the doctor often understands that is if I fast, am I going to drop dead today? That is not what we mean by is it dangerous. Rav Shachter always points out that what we mean by is it dangerous is that will my body be impacted on a permanent basis to the point that if I would have lived to 120 and now I'm only going to live to 119 as a result of this fast, that's also called dangerous. That's also considered to be something that is sakana by our definition of a sakana, even though it may not be the doctor's definition of a sakana. A lot of times people will make the mistake of asking the doctor, they'll say, should I fast? So any doctor in their right mind, is not going to tell somebody. Why would you say, as a physician, why would you tell somebody to fast? Of course you shouldn't fast. First of all, I want to be nice and I want you to like me. So if I tell you to fast, then that sounds mean and you're not going to like me. Second of all, I'd rather not have patients whining to me all the time. So it's much easier for me to tell you to eat. So that doesn't seem like a person, that's not the question a person should ask the doctor. What a person has to ask the doctor is it dangerous for me to fast? Is there any remote chance of sakana on account of me fasting? When it comes to a pregnant woman, probably the way to ask the doctor the question is, am I at a greater risk than any other normal pregnant woman if I were to fast on Yom Kippur? Meaning, is my pregnancy a regular pregnancy, or is there reason to believe that my pregnancy is different and that I'm at a greater risk of losing this pregnancy, Rahman al-San, as a result of fasting? So sometimes the answer is yes, you're at a greater risk. You dehydrate all the time. You wake up in the morning and if you oversleep a little bit and you wake up at 10 o'clock, you're dizzy and dehydrating and passing out. So then obviously a person's not going to be able to fast. So then we'd have to do shir and pachos mikashir. Almost always when we do pachos mikashir, all the person really needs is hydration. Almost always they don't necessarily need food nourishment. What they really need is hydration. Sometimes though a person has a condition where they need food nourishment as well. And the halacha is that the achila and the shtia are not mitztaref with one another. The shir is koseves hagasa of achila and lo lugma of shtia. So if a person, so what they all recommend nowadays, all the poskim recommend is you take a 1 ounce shot glass. That's definitely smaller than anybody's malo lugmav, and therefore you could have that every 9 minutes, 8 minutes, 6 minutes, depending on how badly you need it. We try to be machmir for the 9-minute shita, the longest shita, if you can, because usually that's plenty of hydration anyway. Rav Neuberger pointed out that doctors will tell you that a person needs about 1.5 liters of hydration per day. And if you take a 1 ounce shot glass every 9 minutes, it takes about 4 hours to get the full 1.5 liters of hydration that a person needs. So from 10 a.m. to 2 p.m., you do that, you'll be good the rest of the day. Then there's no reason to continue to hydrate unless the person feels that they're very, very ill and that it might be sakana. Then there would be. If a person has to eat, so Rav Asher Weiss suggested that the best food to eat, where you know for sure that you're having pachos mikashir, is a date, because the shir is a koseves hagasa with the pit, but we don't eat the pits. So if you eat a date, you know you're having less than a koseves hagasa, the volume of a koseves hagasa with the pit. So that's the best food to eat if you could stomach it. If you could, so you buy a pack of dates, and that's what a person has to do. So that's what a person would do in that circumstance. There are many medications that say that you have to take it with food. Many times they're just joking. You don't really need to take it. It's better to take it with food. You'll have less of a tummy ache if you take it with food, but you're not going to die if you don't take it with food. It's not even a remote sakana to not take it with food. So a person has to ask the doctor, probably the pharmacist knows better than the doctor, of what exactly the risk is in terms of taking a particular medication without food. Sometimes a person cannot get a medication down without a beverage. So then we recommend that you make the beverage something that is not roi la'achila, and that way you'd be able to get it down. So what kind of beverage is not roi la'achila? So some people make salt water or something like that. You could use mouthwash. Mouthwash is not roi la'achila. It says on the bottle you're not supposed to swallow mouthwash. You're probably not going to die from the amount of mouthwash you have to swallow to get a pill down. Rabbi Yoni Rosenzweig said that he heard from Rav Yitzchak Zilberstein that if you take I think it was 8 tea bags of chamomile tea and put it in like a couple of ounces of water and leave it there for several hours, you will then have a gross enough concoction that you can then swallow a pill with. So that's an eitzah that a person could do. But and sometimes you could really do without the medication for a day. If a person has bipolar disorder, so very often they're on lithium, and that makes a person very dry, and very likely they will need to be taken with food, even if it will need to be taken with drink rather than with food. But again, the person has to do the research on each medication. When it comes to pregnant women, so it's pretty pashut in Shulchan Aruch that pregnant women have to fast on Yom Kippur. However, we do paskin that if there's a risk of losing the pregnancy as a result of fasting, then you don't have to fast. So if it's a higher risk pregnancy, such as a woman has a history of miscarriages, or this particular pregnancy was high risk at some point, or involved a lot of ups and downs and things like that. So again, a physician always must be consulted, and a rav must be consulted. But it's important to realize the one that changed the whole conversation around pregnancy was Rav Yaakov Yisrael Fisher, who was Dayan Fisher was a Gon Adir, Rav Shlomo Fisher's brother, or Rav Shlomo Fisher was his brother, depending on your point of reference, I guess. But he was a Gon Adir, and he wrote, Rav Neuberger pointed out, he wrote in his Haskama to the Sefer Pnei Baruch on Aninus, of all places. He said, oh, by the way, great sefer on Aninus. Also, pregnant women shouldn't fast, even on Yom Kippur, because I've seen asaros nashim that are mapil as a result of pregnancy. So a lot of people questioned whether that, what his data was exactly, that's the case. If you speak to most doctors, they will tell you that is not the case. I mean, if you give them the truth serum, if you speak to most doctors and you ask them, like, honestly, will a regular pregnant woman lose a pregnancy from fasting? Most of the time, they tell you that is not the case. there is a slightly elevated risk in the 8th month of pregnancy of going into preterm labor, which could be dangerous in the 8th month. In the 9th month, it's usually not dangerous. In the 8th month, it could be dangerous. So one wants to be careful about that and a little more on guard when it comes to preterm labor. When it comes to that, there's a whole host of different mental illnesses and disorders that need to really be studied carefully. Whenever you hear someone say, "Oh, anyone with this doesn't fast," it's not really that's almost never true, no matter what the disorder is. Because let's take something like depression. Depression, as Rav Neuberger pointed out, is sometimes a condition and sometimes it's an illness, and depends where the person is holding, how bad the depression is, how bad, there's a lot that goes into it, and the details need to be looked at in every case. So again, the basics are that if a person is a cholah she'ein bo sakana, you got to fast on Yom Kippur. If you're not feeling well, stay in bed. Rav Schechter is not embarrassed to say, it says in Shiurim that one year he had the flu, and he was feeling like he was well enough to go to shul, but Dr. Muller told him, I was a big tzaddik in the neighborhood, told him that if you're going to go daven in the Aguda, at that time he wasn't davening in yeshiva, he was davening in the Aguda, that if you go daven in the Aguda, it's too cramped, and you're probably going to get faint, and you're gonna faint, and someone's going to give you a drink, and you're going to end up having to drink. Better to stay home. So he said, so I stayed home that year, so that he wouldn't be in that position. So if that's what a person has to do, then that's what a person has to do. So these are just some of the basics. This is not, in general, Temin Halach Shiurim are not meant to paskin from. This one in particular is not meant to paskin from. This is just a basic Rashi Prakim, so that someone should be a little more familiar with some of the issues that come up. Everyone should have a Gemar Chasima Tova.